Shauna, we know that elementary schools have the largest number of active COVID-19 outbreaks compared to all other settings across Ontario. And tonight we're taking a closer look at the reality inside our educational institutions and why experts believe vaccinating our younger children will be a game changer in the fight against this pandemic.
Finally, that last age band can enjoy the same level of protection everyone else who is fully vaccinated has.
Since the school year began, it's been well documented that children are carrying a disproportionate amount of risk when it comes to being infected and spreading the COVID-19 virus. Yesterday, Grenoble Public School in Toronto's Flemington Park neighborhood was forced to close temporarily because of an outbreak. Within the last 2 weeks, 647 Ontario schools have reported 1,357 COVID cases, and many in the medical community are noting that cases are on the rise in our schools.
Definitely time for vaccination here. That should help bring down these case numbers. Now, the vaccines in children will do two important things. It will help prevent infection, and for those who still get a bit sick, it will help them clear the infection quickly. And this is what's needed to bring down those case numbers.
Over the last 2 weeks, approximately 1 in 4 active cases of COVID have been in school settings. And because of the 8-week delay in vaccinating children with their second dose, Omar Khan, a professor of immunology at the University of Toronto, notes that the vaccine won't provide a quick fix.
You still need to give yourself an additional 2 weeks after your final vaccination to start generating your long-term immunological memory. So timing it's not going to happen overnight. It's going to take some time, but it's incredible that we're starting.
As Ontario prepares to vaccinate those aged 5 to 11, public health experts are keeping a close eye on another continuing trend. Of those born in 2009 who are either turning or turned 12 this year, they're less vaccinated than teenagers aged 13 to 17. It's unclear if that trend will continue as we vaccinate younger and younger children.
So I think anywhere where parents can really be getting this evidence-based information so they can help themselves feel more comfortable about vaccinating their kids is really important.
Kate Allen, a postdoctorate fellow at the Center for Vaccine Diseases at U of T, is quick to point out multiple outlets for families looking for science-based, factual information.
So their doctors, if they trust their public health unit, which is, a great place to get information. Toronto Public Health, I know, has done a toolkit for parents, which answers sort of frequently asked questions, which is really useful.
Professor Khan also notes that with kids as young as 5 receiving the COVID vaccine, it's helping protect those aged 4 and younger who may be siblings or in a split junior-senior kindergarten classroom. If your family is looking for some of those fact, science-based links to read about the COVID vaccine for children, just go to our website, citynews.ca, and click on Extras.